I'm Shahar Azani, and in the news, Israel's continuous vaccination efforts and the Palestinians. This week, the British newspaper The Independent published a report stating Israel has supposedly refused an informal request from the World Health Organization, the WHO, to immediately make COVID-19 vaccines available to Palestinian medical workers to avert a potential health disaster. According to the report, Israel cited shortages in supply for Israeli citizens as the reason for this refusal. All this as Israel is safely marching on the path to becoming the first country on earth to vaccinate its entire population against this terrible disease. To date, Israel has already administered the vaccine to around 20% of its population, expecting to complete this inspirational endeavor by this coming March. In response to the accusations, a formal statement from Israel stated the Israeli Ministry of Health, which has a very healthy working relationship with the WHO and is running the current vaccine drive, has never received a request like this from the WHO. Sadly, we are not unused to hearing such criticisms of Israel on mainstream media. And true to the mission of JBS, we are here to seek the truth of the matter. To discuss this issue and more, I am happy to be joined today by Dr. Salmon. Dr. Salmon is the director of the Department of International Relations at Israel's Ministry of Health. He has served as a senior position on the COVID-19 emergency response team of the Ministry of Health in Israel. And before the crisis, he focused exclusively on enhancing cooperation between Israel's health system and foreign partners, both bilaterally and multilaterally. Among other roles, Dr. Salmon is a clinical oncologist and has served as an attending physician and as deputy director of the Hadassah University Hospital in Jerusalem. He was deputy CEO and medical director at Barzilai Medical Center in Ashkelon in the south of Israel, and as a head of the medical audit department at Israel's Ministry of Health. Dr. Salmon, such a pleasure, and thank you for joining us.
Good evening.
I can only imagine the amount of work you're doing at the moment. So let me begin. Israel is currently under quarantine, hopefully the last one. How are things in Israel currently? How is it going?
So we are evidencing now the third wave of this terrible pandemic. This first wave had faded quite quickly. So we had our first patient actually end of February. We peaked at the end of March, and we were out of the first wave sometime at the end of April, beginning of May. The meaning was that we quickly had opened up most of facilities in the country, which led to our second wave, who peaked sometime during September due to the opening of the academic year. We went into a second closure at the end of September and a tight closure during the months of October, and then went slowly back to ordinary life while numbers started to accumulate again, and we are in a peak of 9,000 new cases a day. And so now we are in our third closure, hopefully, as you said, the last one. We would be there at least for another 10 days. And if things would become better, and we do believe that we would see numbers dropping during this weekend and further dropping during next week, we could slowly open again, as well as we are approaching with our vaccine operation.
How has your personal schedule been dealing with COVID-19 in Israel? I can just imagine how much sleep you're not getting.
Oh yeah, quite tough. I would say 10 or 11 months almost. So we started to prepare during the months of January, actually a year ago, when we got the first data from China that a new virus is around, maybe causing a kind of an epidemic. We did close the skies to Israel already at the end of January. We had a lot of internal criticism about that, but that was proven to be right. And as I was mentioning, from I would say the end of February till now, I could hardly think about a quiet day. We are working basically 7 days a week, and these days are long days, could be 18 to 20 hours a day.
Amazing work. Kudos to you and the team. We are really inspired watching here from afar the incredible vaccination enterprise that Israel is engaging in. And I have to admit, we're also not even a little bit jealous. So please tell us, how is it going, the vaccination efforts in Israel, and what are we learning at this point from this vast operation?
So I do believe that today or tomorrow we'll hit the figure of 2 million vaccines which were given. So just above 1.9 million Israelis already received the first dose of the vaccine, and we are around 80 to 85,000 Israelis getting already the second vaccine. It is a complicated operation. It has to do a lot both of planning and supply, as well as good public diplomacy. And I think the combination of, on one hand, the good planning, but on the other hand, the flexibility of really using each and every dose of the vaccine in order not to waste vaccine in a scenario of really being in a shortage. I have to say that this situation of demand and supply also created a kind of a psychological atmosphere when people are willing to queue to receive the vaccine. As it is, it seems that Pfizer would supply us sooner than later with a substantial amount. Hopefully, we could continue on at the same pace for a few more weeks. And if this ambitious plan would continue on working properly, hopefully till the end of March, the majority of the Israeli population will be vaccinated.
Amazing news. In New York and elsewhere, there has been a lot of criticism for supposedly throwing away vaccines at the end of the day or not vaccinating enough people. How is Israel doing it, making sure not to throw anything out?
So as I said, we have 350 centers, vaccination centers, all over the country, from the north to the south. Some of them are huge, some of them are small. We are able to supply as little as 50 doses to a certain point. It's a big logistical and operational issue, but it is possible. And at the same time, we are acquiring information of each one of these centers and finding out if at the end of the day we are expecting to have some extra doses. In that case, we do send at the end of the day in a kind of a standardized system first responders. It could be fire brigades, policemen, ambulance drivers, and so on. So in that sense, nothing is waste. There was a phenomena that we didn't actually encourage, but it did happen, and it's working sometimes, when young people, which are not entitled yet to receive a vaccine, would queue at the end of the day, and in some cases they would be vaccinated.
Wow.
So we are doing what we can, not even to waste one single dose. It occasionally would happen, but when I do hear about a situation like that, I would try to take the lesson and to find out that it would not happen again at the same site.
So Dr. Salmon, I have to tell you, we may have to import you to New York to run the operation here as well. I wanted to touch upon the story that I mentioned in the opening, and maybe talk about the vaccinations and their relationship with our neighbors. You are the head of the international department. You deal with other nations. What is the situation right now vis-a-vis the Palestinians, Gaza, and others? And is there any truth to the claims that Israel is holding vaccines from the Palestinians?
Well, we have to understand the legal and the political situation. I'm in charge as part of my duties for the daily relationship with the Palestinian medical authorities. And I have to say, from the beginning of the COVID-19 pandemic, we are collaborating, and we tremendously, in a very quiet way, help the Palestinians, both in the West Bank as well as in Gaza Strip, to properly cope with the pandemic. Regarding vaccines...
Wait, before you mentioned help, can you expand on that for a minute? What have you done? What has Israel done to help?
Well, it was everything from supplying testing kits to supplying protective gears to training. We did also assist with ventilators. We coordinate a lot of international assistance, and we had spent quite a lot in really trying to assist the Palestinians. We have to understand that a virus doesn't really recognize borders. So if there would be a terrible eruption in one side, it would influence the other side. So clearly enough, we are very much trying to assist our Palestinian neighbors in reducing numbers as much as possible.
And that's in Gaza as much as it is in the West Bank?
Indeed. It's not it's not a thing that you would go, newspapers and publish, but certainly we were very much concerned of what's happening in the Gaza Strip, and I think we were very much involved also in supporting there as we could. Now, there is a big difference between the political difference between the West Bank and the Gaza Strip. We have to understand that from the West Bank to Israel, we have crossage of around 100,000 Palestinians a day back and forth. And it's very clear that if they carry a very high level of disease, it would influence Israel. So it has a lot to do with many, many aspects of the pandemic, from local control through massive testing, through many, many other aspects. Now, regarding the vaccination issue, we have to understand that everything that has to do with medical supply to the Palestinians under the jurisdiction of the Palestinian Authority is related by the Oslo Agreement and by the Paris Treaties to the Palestinian Authority. They are responsible for the help. We do assist quite a lot, even on a daily basis, when, for instance, you have a complicated medical situation and we are willing to hospitalize Palestinian and Israeli hospital, but it's always through the Palestinian Authority Health, Ministry of Health. Now, regarding now, we did not receive any formal request for vaccines. There was some publication about small amounts of vaccines that we were able to deliver, but that's it in that sense. At this point, I have to notify you that as much as we know, the Palestinians have good agreements now, both with AstraZeneca and with Russian Gamaleya Sputnik 5, as well as expecting to get another 1.2 million vaccines from COVAX, a big joint effort of WHO and Gavi. That these three approaches should, in the next few weeks, cover the whole Palestinian population. We would assist in any logistic that is needed for that, and hopefully, as it would happen, we would see the Palestinian maybe being the first Arab big community or big population which is vaccinated in our region of the Middle East.
This is terrific news, because I have to tell you, Dr. Salmon, you do not hear this information here. The focus is on criticizing Israel, and I think it's very important for our audience and for everyone to pay attention, and also to the spirit of your statement as far as collaboration and hoping that the Palestinians will indeed be able to move forward with the vaccinations on their own. So thank you very much for sharing that with us. So that story was a blatant lie.
Mm-hmm. Indeed. There were many publications, mostly in Europe, but not only, stressing the fact that Israelis would somehow jeopardize or would ignore the needs of Palestinians to be vaccinated. We are very much sympathized with that. We are still in a realistic situation where we are struggling to receive enough vaccines to vaccinate the Israeli population. We have many requests from all over the world, but at this point, we would certainly finish vaccinating our citizens, and then we will be able to assist also others. And first, of course, would come our neighbors.
As it should be, and as you mentioned correctly, the situation is indeed governed by the Oslo Accords and the Paris Agreements, and then the Palestinian Authority is fully independent and free to manage its operation, and hopefully and naturally in collaboration with Israel. 100,000 people a day, that's incredible, passing from the West Bank into Israel. Thank you for clarifying this story. I mentioned at the beginning in your introduction that you are heading Israel's Ministry of Health International Affairs Department. Let's take a moment. Could you share with us, what does that work entail in this regard? What do you do at the International Affairs?
It has three main parts. The first one is multilateral activities, talking mostly about WHO. We are now still executive board members of WHO, and we have a lot of work and a lot of say inside the organization. We are very much involved in specific areas like emergency preparedness, like digital health, like many other aspects that I think Israel has a relative strength and could share its experience with WHO and the world. We are involved quite a lot with OECD. I'm sitting at the Health Bureau of the OECD, and we are doing quite a lot of work with them and I think for the benefit of everybody. And we are much involved also with other agencies around the world. Then there's a lot of bilateral work where we are under a cooperation agreement with many countries and states all over the world, trying to create cooperation and mutual project in benefit of both sides. And we are doing it actually all over the globe. And then, of course, is our close neighbors. And as I have mentioned before, I'm much involved also with the cooperation with the Palestinian medical authorities.
This collaboration in the field of health, do you feel that it is impacted by political realities, or do you feel it stands alone because of Israel's expertise?
Well, politics is always a part of everything, but I think we are trying to break stigmas, and we are trying to bring in front the nice and I think the impressive side of the state of Israel in sense of good clinical services, a universal health coverage system which is working for the benefit of 100% of the population, advanced digital health services, and a lot to do with genetics, oncology, precision medicine, and a few other fields that Israel has quite a lot of experience. So in that sense, we are pushing ahead what we could offer at the medical aspects of things. Whether politics interfere, well, sometimes it does, and it's always an issue how to properly deal with these issues. I think it has a lot to do with transparency and with honesty, as well as by standing for your principles and saying what you have to say in a simple and a direct way.
So your work done generally to build bridges between Israel and the world, and not, like you adequately said, share Israel's knowledge. Did it change in the course of COVID-19, or were you focused in the last year on collaboration in this specific field?
Well, I think during the last year, 95% of our work was around COVID-19, and also on the international level, both multilaterally with an international organization, but certainly in bilateral connection. There were so many countries which were interested in what is happening in Israel and having some of our lessons and experience be shared. I have to say that I found out that many countries that we did not have any connections before, which were eager to establish health cooperation between certain countries and Israel, and I'm talking all over the globe, Africa, Asia. I think we had till now discussions with more than 70 countries around the world during the COVID-19 crisis. In that sense, I think we tried to share, to collaborate, and to assist where we could.
And just last question in this regard, what did you find to be the main spheres of collaboration of Israel with the world? What were these countries mainly interested in when they came to Israel?
Depends where, but the main topics that the world is looking to Israel is first emergency preparedness, as we are very much organized and we have quite a lot of unfortunate experience with emergencies. It has to do also with the fact that Israel has a very, I would say, construct system of collaboration between different governmental and national agencies, which is maybe the first lesson that you always should give in a time of a crisis, including the COVID-19 pandemic. Then Israel had a lot to do with, as I was mentioned, digital health, from medical health, electronic medical records to kind of national cloud of medical data, which is properly protected, but still allow physician in every clinic to gather information for a patient that we are seeing just now, as well as specific other fields that there is a lot of interest in Israel, like as I have mentioned, genetics, precision medicine, some aspects of oncology and CAR T-cell treatments, and a few other things that Israel has quite an expertise in. So in that sense, for each country, it could be a version or a different mixture of fields of interest. So basically, we do ask people, what are you interested in? One of the things that we did start to develop is things with health economy and also, I would say, primary healthcare planning and controlling, which I think is quite developed in Israel and some countries like India, for instance, were seeking to get a lot of information in order to be able maybe to take some of our lessons into their approach into primary healthcare now in India.
Thank you very much, Dr. Salmon. Thank you so much for taking time off of your very busy schedule to join us. It's been a true inspiration.
Thank you very much. And I really hope that in a few months we'll be over this terrible pandemic and we could go back to life.
And I am telling you that hopefully we'll be able to have you again, not just speaking about COVID-19 and after you've gotten enough sleep. It's been a pleasure having you, and kudos to you and your team for the incredible work that you've done in the course of the year and the incredible vaccination operation in Israel, which we all look admiringly at. And there you have it, another lie debunked. But please don't keep it to yourselves. Lies are easy to spread, but we have a chance here to make the truth's voice heard, loud and clear. Make sure to spread the news and do not let these lies simmer. All too often we face these accusations, libels, and we must raise our voices and stand up to them. Stand up for the truth and share the incredible story that's being shared with us from Israel by Dr. Salmon and others. Be a beacon of truth. This is exactly what we're doing here at JBS today and every day for Israel and for the Jewish people. Thank you all for watching, and to all, we say stay safe and stay healthy. I would like to thank our director, Sloan Copeland, JBS's managing director, Dara Golob, our technical manager, Michael Paley, transmission manager, John McDevitt, and to our wonderful producer of In the News, Carol Lilienthal. For JBS, I'm Shahar Azani. Until next time, see you soon. Shalom and Leitro.